COVID-19 in Sub-Saharan Africa, the good news, part 2. I'm going to pick up right where I left off at the end of part 1. Of course, what we really care about is deaths per day. And this graphic shows the rapid rise in deaths per day in Italy, peaking somewhat over 900, and then a slow, noisy decline. For Africa 12, the number of deaths per day is so low that it barely registers above the horizontal axis. And as I pointed out before, because Africa 12 has 330 million people and Italy only has 60, we would really have to divide this line by 5 in order to adjust it for population. And if we did that, it would basically merge with the horizontal axis. What this is basically saying is that COVID-19 has failed to get a toehold, at least in this subset of 12 African countries. Now let's compare cumulative deaths in Italy versus the 12 African countries. In fairness, I realize that Italy got the virus before Africa, although certainly there were Europeans and Chinese flying to and from sub-Saharan Africa as this disease was spreading around the world. As of April 17th, Italy, with a population of 60 million people, had cumulative deaths of about 23,000, whereas the 12 African nations, with 333 million people, had cumulative deaths of only 75. If we were to adjust this population of the 12 African nations to be equivalent to that of Italy, we would have to divide this number by 5. If we also then divided the 75 by 5, we would get 15 deaths. This low number of deaths begs the question, how many of the deaths in the 12 African nations are from older elites, perhaps, who caught the virus while traveling abroad, came home, and died? So the good news is that so far the empirical evidence strongly supports the preliminary conclusion that sub-Saharan African nations are far less susceptible to deaths from COVID-19 than is, say, Western Europe or the United States or other areas of the world. Now, could it be that right around the corner in another week or so, we would see this steep exponential rise in deaths or in cases and in deaths such as we witnessed in Italy? I seriously doubt it because of the 3 differences enumerated earlier in this analysis. There's simply not enough old people, there's not as high a rate of obesity, and it's a much warmer climate. Despite the good news, I've heard that a number of African nations are taking steps, Western-style steps, to try to reduce the possible deaths from COVID-19. Well, Africa has a lot of problems already. Infant mortality, starvation, armed conflicts, and so on. Is it possible that Western-style restrictions that are associated with COVID-19 could actually cause more deaths than they save? Well, it is possible to the extent that, for example, they limit transportation. Then there may be people who can't get to medical facilities for needed medications and for treatments. There may be problems with food distribution and so on. I've heard that in some areas they're burning markets. And, we're carefully counting the deaths from COVID-19. Are we counting the deaths from the efforts that are being enacted in Africa in order to prevent the death by COVID-19? A related question is, what are the opportunity costs of using the same resources and attention that's being applied to COVID-19 to save lives in other areas? There are probably other uses for those resources that could save more lives. I wanted to finish with a reflection. There's a quip from the 1920s that says, 5% of the people think, 10% of the people think that they think, and 85% of the people would rather die than think. Well, if you've made it this far in this presentation, congratulations. You're probably not part of this 85% because those people are off somewhere watching cat videos. So the question is, are you part of the 10% that think that they think or the 5% that actually think? The difference between the two is that the 10% cling tightly to their narrative of the world, and when new evidence comes to light that disagrees with that narrative, they find very clever rationalizations for rejecting that evidence. The 5% of the people, they have a narrative as well, but when new evidence comes to the fore that conflicts with it, they modify the narrative accordingly. Why am I talking about this? Well, in this pandemic, There are many people, including very smart people with PhDs and in high positions, who seem to have lost their ability to think, but are instead responding emotionally based on fear. As a result, they start not thinking clearly. And an example of that is raising death by COVID-19 as being somehow the singular most important thing that we care about. And a simple example of that has to do with Sub-Saharan Africa, where people may be so concerned about death by COVID-19 that there are actually more people dying of the measures taken to try to control it. So my plea would be for people to cast off their fear and start thinking rationally about this problem.